Friends. So this is an update to my last post. A lot of you want to know what's going on. You've asked how you can support me, and I really wanted to say thank you for all of your kind words. So, what is going on is I've had issues my whole life since I very first started at 11 or 12 years old when I started my menstrual cycles with having issues. My periods were always very painful. I was never able to have children, and I pretty much consistently would miss time every month from school or work because I was miserable and in pain. So, of course, it did keep me from being able to have kids. And now I'm going to have a hysterectomy. So, what happened is I'm 57. When I was 38, I had a very big surgery. They thought they were taking me in for a laparoscopy, but they were not able to get into my abdomen. Everything in my abdomen was scarred together. And what that meant is they had to do a surgery that is the same as a C-section, which means they had to cut my tummy open and pull all of my organs out. At the time, I had a large grapefruit-sized cyst on my right ovary, and after a certain amount of time, if they can't get them to resolve, they become life-threatening, which means they can either twist, which they call torsion, or they can rupture, and neither is a good idea. They're both really not good for your bodies. They're painful, and especially when they're extra big. So what's going on, or what happened in that surgery, is they had to take everything out of my tummy and separate it before they could take the cyst out because everything inside of my stomach was adhered. What happens with endometriosis is endometrial tissue from inside the uterus gets into the abdomen. They don't know how it gets into your stomach, but what happens is the endometrial tissue attaches to your internal organs, and they end up attaching and growing there, and they respond to your hormones, which means there's blood, but there's nowhere for the blood to go. So it sits inside of your tummy on your organs, and every month responds to the hormones, which is what causes the pain, because the blood, like, it bleeds, but there's nowhere for the blood to go. And then it sits inside of your stomach and becomes toxic and just basically causes the adhesions or the scarring, and before you know it, everything in your stomach is scarred together, and you basically can't really get into the abdominal cavity. So that has happened to my stomach again. I have, on the left side this time, I have a grapefruit-sized cyst, and that fallopian tube is filled with blood. And then inside of my uterus, they found that I have something called adenomyosis, and that is basically the same thing as endometriosis that I have on the outside, but it is endometrium tissue that, instead of shedding, that tissue like grows into the uterus wall, and it disfigures and misshapes your uterus. And then inside of my uterus, I have polyps and fibroids as well, and also more adhesions. So that means that there is tissue inside of my uterus that has also caused more adhesions. And basically, I think it means the walls are sticking together. So September 23rd, they have scheduled another surgery for me to take everything out. I did have an option of staying in the gynecological department or going to gynecological oncology. And I want to be clear, the doctor does not think I have cancer. And the tests have come back, I would say inconclusive, but I don't want anybody to be thinking I have cancer, because 99% sure I don't. However, a doctor told me that if I had a chance to get this surgery done in an oncology department, that it would be far better for me, and for the surgery they're doing, it'd be better, because doctors who deal with cancer deal with bodies that have trauma all the time. And endometriosis is sticky, and I guess it's similar to cancerous tissue that it can be sticky. I'm not sure if I exactly understood that, but they deal with this a similar trauma. So they would be better at being able to manage all of that. They don't think my bladder or my intestines are involved, and that's a big blessing because the last time I had a surgery, back when I was 38, that surgery they told me they thought they would have to remove most of my lower intestines and that I would have a potentially non reversible colostomy bag. And as you can imagine, that really worried me. But as it turns out, they did an MRI because they did think the cyst was actually a fibroid, and it's not. They did the MRI and found out that it's a cyst, but they also looked at my bladder and intestines, and they don't feel there's any damage there, which is really, I'm so incredibly grateful for. Anyway, I know this is kind of a long video, and I apologize for that, but it is a lot. The last surgery, I was in surgery for 8 hours. That was because they thought they were going to have to do a laparoscopy. That's where they do just little 1 inch incisions, and they go in with a machine and they can remove things like cysts. But they couldn't do that with me. But that's what they tried to do. They can't do that now. In any case, my surgery is at U of M, which is amazing. What an opportunity, because, in Michigan, I really believe that U of M is the best. And the surgery, the last one was like 8 hours. This one, I don't think it's going to be as long. I bet they knock at least 2 hours off because they tried to get in with a laparoscope last time and it wasted a lot of time. My doctor is not going to waste any time doing that because we already know everything's adhered together and they're not going to be able to enter my abdominal cavity with a laparoscope. So, September 23rd, I'll be at U of M. Feel free to call or text after surgery day because I will be in touch. I'll let you know how I'm doing. I'll stay in contact. And, I know it'll be a lot. I'll be out of commission for 6 to 8 weeks. I think after the first 4 or 5 weeks, I will be comfortable doing readings either from home or video call and telephone. But by 8 weeks out, 6 weeks out, I'm hoping I'll be ready to go out of the house and be working again. I am worried about, of course, finances, how I'm going to get through this. It's been a very, very tough year. I did try to get things in order, but that's been really hard for me. And I am starting to actually have a lot of pain on my left side. Cysts that large, and when your ovaries, your uterus, when your uterus is enlarged and you have cysts, it pushes everything out of place. And that has caused muscle cramping in my sides and pain in my back. I also had some really severe anemia because I was bleeding constantly, and that has been stopped. I went for 5 iron infusions this year. Wow, was that amazing. I did not realize until I finished 4 or 5 of them, I had 5. But once I got through the last one and my blood got back up to normal, I felt amazing. I got some energy back. I'm still sleeping a lot. I don't feel great most of the time. But I am feeling better. And I just thought I should share. A friend of mine is doing a GoFundMe to help with expenses. And if you are able to contribute to that, I really appreciate it. You have no idea how stressful this is. Not feeling good, not working as much has been really difficult. I'm so excited to get this surgery done and get back on the road and be able to start working as much as I would like to be able to work. I love doing my mediumship and my psychic stuff. And, if you want a reading this fall, you better get on it before I have surgery. Anyway, that's my update. I know it's a lot. I'm sorry if it's too much detail. If you have any questions, I do love all of my friends and very connected to and love my clients. And if you need anything or if you have questions, I am not the kind of person who's offended if you want to know what's going on or things of that sort. And I will not be able to lift or do a lot of things. I did put out that I need some help, and I'm going to work on getting that out there and making sure that you all know how you can help if you're interested in doing that. But thank you so much, my dear friends, and say a little prayer for me. September 23rd. I'm not nervous about surgery because I've been through surgery. It's hard, but it's not difficult. Keeping me in the hospital for 4 nights will be amazing. We're hoping I don't come home with any tubes or drains, but even if I do, they'll be having a nurse come to take care of me. So I have no doubt that everything will go fine and that I'm going to be okay. And I have no doubt I'll recover. But I can't not say I'm a little nervous. Anyway, my dear friends and my family, I love y'all. And thank you for listening. And I hope to talk to any of you if you have questions. Thanks. Bye.